Marcia Ory is a professor of public health at the Texas A&M School of Public Health. Marcia, great to have you with us. Thank you very much. What do you think when you see these kind of mass campaign rallies that we see President Trump holding? He spent the weekend in Nevada, for example, having one event after another. Are you predicting a spike in coronavirus cases there?
Certainly we know that large gatherings can be super spreader events. So it's not within the best public health practice to be having large events with people not being socially distanced or wearing masks.
Can I ask you about the effectiveness of various measures that we're seeing being brought in, particularly across Europe right now? They're battling a second wave, closing bars, closing restaurants. The problem seems to be that once these restrictions are eased, the infections resume climbing. So what do measures like this achieve?
Well, and what we do know is that there's pandemic fatigue, and we heard that in the earlier reports. People were willing to be able to be at home, shelter in place, wear a mask, not go to work. I think that you're right. The minute that the lockdown stopped, the surges started again. It's really difficult to imagine the same behavior we've been doing for the last 7 months to go for the next year or year and a half. But what we do know about the virus is we've got to stop the spread. And that's why I think the European countries, other countries are reestablishing lockdowns. But the key is to try to keep them to a minimum, because we want to be able to balance safety of people with the economy. So it's really a trade-off both ways.
Yeah, and it does appear to a lot of people that that trade-off is not being effectively achieved. One school of thought is to go about life as normally as possible, but just put certain precautions in place to protect the vulnerable. What's your opinion on that? Would such an approach be possible?
Well, certainly we saw Sweden that started off doing that, and that was not a successful approach. I think it's because we have to consider who's most vulnerable and who's most likely to spread. There's new research coming out that show that children will be impacted less, but they're likely to spread children, youth, college students to others who are more vulnerable. So it's not like we have a society where people stay apart based on vulnerabilities. We have a society where families want to get together desperately for the holidays. So it's very difficult just to think we're only protecting one group when there's intermingling across different groups.
Marcia, good to speak with you. Thank you very much indeed for that. Marcia Ory there.